Longevity in rhinoplasty and functional preservation require good nasal structure, good nasal support. A good result that's going to look natural and not artificial is going to have contours that are based on a stable and strong underlying nasal structure. Often there's grafts used to support the septum. These grafts are critical in order to avoid having a result that looks good at 3 months, but over 6, 9, 12 months, 5 years, starts to shrink, wrap, and collapse and sort of have those telltale signs of rhinoplasty. It's not just enough to make it smaller, because if you make it smaller and angular and sharp, it's not going to look good. So things need to have a gradual change in their contours so that the shadow and highlight that's on the nose in photographs or in overhead lighting looks natural and not man-made. The final element is about proportions and balance. Things have to have a certain size relative to themselves, relative to the patient, relative to the rest of the face, in order for them to look like they fit. Now, some of that can be worked out in an imaging consultation preoperatively, but there's a certain artistry to how these things come together, especially on the day of surgery. And one of the things that's critical is to not overdo any one area. And the goal of that is to make the right balance. So ultimately, all these concepts come together in my mind when I'm doing the consultation. The idea of functional preservation while at the same time making a nose smaller, and the idea of making a nose that fits the patient. These are the things that are critical to an outcome that no one else on the planet should really be able to tell that it was surgically created.